absolutely delighted to say we're joined by Dr. Julian De Silva, a highly revered, very experienced and distinguished consultant ophthalmologist, to discuss all things orbital fat and eyelid contour for today's podcast. Dr. De Silva, I beg your pardon, if you'd like to provide background information with
Yes,
regards to your experience before
yes.
getting into the topic.
Well, Colin, it's a pleasure to meet you. Thank you for doing this podcast with me. I've been practicing oculofacial plastic surgery, cosmetic surgery for now, or more than 10 years. And during my experience, I did fellowship training in London, in New York, in Los Angeles, and Beverly Hills. And now my practice has been running for more than 10 years. And so blepharoplasty or eyelid surgery, face and neck lift surgery, rhinoplasty. And these are surgeries that I do every day for my patients. And at least 20 to 30% of all the patients I treat are revision surgeries. So I'm very much in favor of providing patients with quality information so they can make the best decision for themselves.
Excellent, Dr. De Silva. Fantastic, and your experience will really show, I'm sure, in this podcast, which is
Yes.
fantastic. If we want to maybe get into the first question, then, Dr. De
Yes.
Silva, how does preserving or repositioning orbital fat contribute to a natural post-operative eyelid contour?
Yeah. I think repositioning the fat is of such key importance in this area because the area under the lower eyelid is such a delicate area. The skin there is actually less than half a millimeter thick. So even the tiniest imperfection, you can see that. And if there's hollowing there, you just start to see a depression, a tear trough, and ultimately, with time, that can lead to a dark circle or a shadow, a ring under the eye. So any preservation of natural fat is very favorable here. And younger people will try some fillers in this area to restore volume. But when it comes to eyelid surgery and lower blepharoplasty, preserving some of the fat is kind of essential because if fat is just taken away, it can result in hollowing, and that won't necessarily give like a natural and good result. In addition to like preserving fat, I often use something called fat transfer, which means taking a
Okay.
little bit of fat, usually around the belly button, but sometimes elsewhere, and then we concentrate that fat and then just put like a modest amount between the lower eyelid and the cheek. And what that will tend to do is just kind of make everything smoother. And from my experience, it will also make any eyelid surgery, lower blepharoplasty, last much longer. And so I think fat preservation, adding some fat where necessary is so key to a good result here. And with patients that have had surgery elsewhere and have come to see me for revision surgery, often that's something that I need to really address to give them like a good natural result.
Fantastic, Dr. De Silva. And in your experience, I suppose, just picking up on what you said at the end there, do patients really value that kind of change in that result, that difference that it makes in their final outcome?
I think, yeah, I mean, lower eyelid changes often mean puffiness, sometimes bags. And although we often think of that as being related to someone being tired or lack of sleep or stress,
Yes.
often this is purely anatomy. And in a way, I have younger patients where it's not really aging, it's kind of genetics. Maybe one of your family members or your parents has bags, and then they've kind of genetically given you similar kind of anatomy. But people will say, like, are you tired? Are you not sleeping well? Are you stressed? And so often, lower eyelid surgery, it can be quite a dramatic change for some people. Like, it can be, I mean, I think life changing is sometimes overused, but if a lot of people every day are saying you're looking tired, it can actually wear down on you. And if this area is kind of freshened up with lower blepharoplasty, fat transfer, it can actually make a really significant difference to those people.
Absolutely. And it's great
Yeah,
to see that patients are actually grateful and they really understand the,
yeah,
the difference it can make in their vision, in their natural appearance as well, because cosmetically it can really make a big difference.
yeah. And it's certainly in the past, some of the older techniques that were used in this area were more along the lines of reconstructive plastic surgery. And the challenge with those older techniques is that they could change the shape of the eye very slightly. And that could be very frustrating because it could change the character of someone's face. The eyelids are so key to your kind of natural kind of appearance. Really, we don't want to do that. Really, we want to use like techniques that conserve your kind of character. They just freshen up the areas that look tired, but they don't change the shape of your eye. And so I think that's like certainly a major innovation over the last kind of 5 to 10 years. But with those older techniques, sometimes I would have like patients like be quite frustrated because they could notice very subtle changes that just change their just characteristics of their face.
Absolutely. And then leading us nicely then to question number two, then, Dr. De Silva.
Yeah.
In what ways can respecting the patient's their natural eyelid crease placement enhance the authenticity of the
Yeah.
result?
So kind of so the natural crease is in the upper eyelid. And in a way, that crease is a bit like a fingerprint in that everyone's crease can be slightly different. And like in an average kind of Caucasian person, it might measure from 8 to 12 millimeters, but in a way that doesn't take into account the huge variation naturally in ethnicities and different shaped eyes. There's so much individuality and often there's asymmetry as well. So key though with a natural upper eyelid is to hide the scar in that crease. Now, sometimes it needs adjusting because if there's things like asymmetry or if there's two creases, it needs to be brought into one. But certainly, like some of the patients that I've treated where they've had eyelid surgery with more visible scarring and then I've revised it for them, that would be a common thing. The natural crease has not been like adhered to and the scar has been made either above that crease or below it, and then that hasn't looked quite right or it's left a visible scar. But generally with upper eyelid surgery, if we take care to look at that natural crease, the scars usually are virtually invisible because it will hide in that natural crease that makes it very difficult to see.
Oh, fantastic. Well, it's a really, really innovative and very patient
Yeah,
benefiting surgery. So it's really,
yeah,
really good that it's available these days.
yes,
Fantastic. And then question number three, then, Dr. De Silva.
yes.
What role does canthal tilt and lid cheek junction play in
Yeah.
achieving a harmonious, youthful look in patients?
So when we talk about canthal tilt, what are we really referring to? Well, we're really talking about where the very corner of the outside of the eye, the canthus, is positioned. Now, in most people, there can be just a very slight gentle tilt in terms of where that position is related to the inner part of the eye. But there's also a lot of variation naturally in ethnicity and sometimes asymmetry. Generally speaking, with most eyelid procedures, we really want to preserve that area because that area is so key to like the characteristics of the eye. And if it's changed, someone can look different and it can make the eye either smaller or slightly different shaped or asymmetrical. Now, with doing that, the older techniques, which were more based on reconstructive surgery, like repair after trauma and tumor, well, those plastic
Mm,
surgery techniques extended out to the corner of the eye and they could just
okay.
subtly change the shape. Modern day surgery, well, we actually look to preserve that. We do the surgery on the inside of the eyelid, avoid scars, and preserve that part of the canthus so that the shape is remained the same. Now, there have been like changes with fashion in terms of there was for at least a period, there was a number of patients or kind of celebrities who were having like this area kind of lifted and the canthus changed. And there's
Okay.
been a kind of a mixed opinion on that because it can be quite a drastic procedure. And there were quite a few people who had like negative outcomes. And one of the challenges with fashion is fashion changes. And what can be
Mm,
desirable one year may not be desirable in another year. But
absolutely.
changing that position of the canthus, it's very difficult to unwind. Once it's been moved and changed, it's very difficult then a few years later then to kind of unwind that and go back to how the original shape was. And so it's something that definitely needs careful consideration, and it's probably a little controversial in the area of like kind of ocular plastics and facial plastic surgery.
Oh, very interesting. And then, is there a specific criteria then for patients who would actually be suitable to undergo this
Yeah.
kind of transformation?
Yeah, I mean, there are a group of patients or group of people in the population, this is probably less than 5%, where there might be asymmetry or there may be
Mhm.
weakness, like laxity. And often those things get worse with time. But if the actual eyelid is loose, it can start to droop very slightly. And then there can be like a good
Okay.
indication for lifting and tightening that area to restore the anatomy to like a good position. And that can be very important in terms of eyelid retraction. And there was another question that you kind of referred to about eyelid retraction. But if that area is a little loose and surgery is done in the lower eyelid, if care is not taken to preserve that anatomy, the eyelid could droop afterwards. And that definitely wouldn't be a good
Mm.
outcome because that would be kind of eyelid retraction and it would change the shape of the eyelid.
Absolutely. So careful consideration for sure, and a small
Yeah.
percentage of people would be suitable. And then
Yes.
question number four, then, Dr. De Silva, how does careful skin excision help avoid a hollowed or overdone appearance
Mm.
in the eyelid?
Yeah, I think this is kind of a very key question because some of the most more negative outcomes, particularly from lower eyelid surgery, can be related to this and the eyelid looking too low afterwards. And I think there's probably about three considerations with it. Firstly is the technique. Like in terms of modern day aesthetic surgery in this area, transconjunctival surgery done on the inside of the eyelid preserves natural anatomy, it doesn't pull the eyelid down, and it protects you from kind of side effects from this kind of surgery. The older technique, which involved a cut through the skin, and surgeons would go through all the layers of the eyelid to get to that puffy fat. And in medical jargon, this is called transcutaneous surgery. Well, sometimes when that healed, it could pull the eyelid down, and that could be very frustrating. And particularly
Mm.
younger people who have a certain anatomy called negative vector, that could be like a significant issue because it might require other treatment or surgery to correct. So I think with modern day techniques, doing the surgery on the inside of the eyelid, we can very much like protect from these kind of issues. The other thing is having enough support in the lower eyelid. And we talked a little bit about using fat transfer to restore volume in this area,
Yes.
but that also can support the lower eyelid. If the eyelid is coming down a little bit, it will support the lower eyelid. And then there's also a question of being meticulous with this area because many people with finer skin can notice really from their kind of 30s onwards, when you smile, your cheeks lift up and you get a bit of bunching of loose skin. And we can
Oh.
take away a tiny pinch of that loose skin, but we want to be cautious because if we take too much of that skin, well, when you stop smiling, the eyelid would pull down. So it is really
Okay.
being meticulous with this area, not to overdo things. Um, and I think, I mean, in a way, the lower eyelid is such a delicate area that, I mean, quite a lot of the patients that I see who might need revision surgery, often we need to do something else as well. Because if really too much has been taken from the lower eyelid, well, it's very difficult to put some skin back. You know, if it's been taken away, we can't take skin from someone else and somewhere else and put it there because you'd see like a patch.
Aha.
Sometimes we'll have to actually lift the face because lifting the
Oh.
face will draw everything upwards and add enough soft tissue and volume to restore that natural anatomy. So sometimes it can be more sophisticated because the anatomy has been changed, particularly in like revision surgery cases.
Absolutely. And then leading nicely then to question number five, Dr. De Silva. Um, why is patient-specific customization essential in maintaining ethnic and anatomical identity?
Yeah, so I think this is kind of key because most people want to improve the eyelid area, but they want to really look the best version of themselves. Like most people are not
Uh-huh.
looking to look like a different person or a radical change. And sometimes that can be very important in that everyone's eyes are very different. And so, particularly with patients who have facial aging, I always ask patients to bring an old photograph. And, if we can see how your eyelids were, say, from your 20s or early 30s, we can see how that change has occurred naturally. And I mean, I have a good idea now from experience from doing this for over 10 years, but because everyone's eyes are individual, we can use an old photograph as a template because we don't want to go too far away from that. And then when it comes to ethnicity, well, we have to be careful with scars because scars can be more visible in ethnic skin. So as we were saying, hiding the scars within the skin crease and the upper eyelid is kind of key importance. And then in the lower eyelid, well, often we can look at doing the surgery on the inside of the eyelid, which actually will avoid any scars at all. And I would say that's very important because once a scar's been made, it's virtually impossible to like hide it. It can be modified and improved, but you can never kind of take that scar away. I had a patient come to see me, and it was like a few years ago now, and he was a very anxious gentleman. He was of ethnic skin, and he'd actually
Okay.
been for 14 consultations in the UK.
Wow.
And and so he'd seen a whole bunch of different surgeons, plastic surgeons, specialists. And interestingly, like over half the surgeons he had seen advised him he's going to need a cut under the eyelid and under the eyelashes and across the eye. And bearing in mind he was an ethnic gentleman, he was relatively young, like in his late 30s, that probably was not the best way to do the surgery because it would have given him a
Okay.
visible scar. And so doing the surgery on the inside of the eyelid prevents any kind of visible scar and will conserve the kind of natural appearance of the eyelid.
Wow, that's a very interesting case. Actually, you mentioned there, Dr. De Silva. So,
Yes.
like you say, very careful consideration, and age is a big deciding factor when patients are being evaluated,
Yes.
and the comparing of the past appearance to make sure that the reference is kept as close as possible.
Yes. Yeah, absolutely. Age is really important because younger people will not tend to have that much loose skin. And so if you don't have much loose skin, well, we don't really need to make a cut in the skin. We can avoid that completely. And even if there is a little bit of loose skin, well, sometimes rather than making an actual incision or scar, well, we can use a laser. We can use a laser to stimulate collagen in the skin and tighten the skin without actually cutting the skin at all. And so CO2 laser combined with eyelid surgery can be very helpful in improving things.
Fantastic, Dr. De Silva. Well, our last question then for today's podcast. What techniques can help avoid scleral show or rounded lower eyelids
Mm.
post-operatively?
So I think this question, well, we've touched on it a little bit, but in a way, firstly, the a, a careful assessment of the eyelids, because although the majority of people will have sound anatomy, if there's a natural weakness there, such as like at the outside of the eye, often that eyelid will need some port, and that might need techniques such as canthopexy or canthoplasty just to support the eyelid during the healing period. The second thing is like the technique. So, as I mentioned to you, going through the skin, which is known as transcutaneous technique, is more hazardous because it goes through all the layers of the anatomy to get to the puffy fat, and that itself can create a scar that can pull the eyelid down. Whereas if we use a technique on the inside of the eyelid, transconjunctival surgery, and on my YouTube channel, I have like an animation video that actually shows kind of the difference between
Oh,
these two.
fantastic.
The transconjunctival technique preserves the middle anatomy of the eyelid, so it won't tend to pull down. And then also the associated techniques like blepharoplasty. I mean, it comes from a Greek word which means to modify the eyelid, but often in its context just means taking away skin, taking
Uh-huh.
away fat. But as we kind of alluded to, that's not the whole story. Having more fat, more volume under the eye supports the lower eyelid. And so that's the kind of like, I would say, key aspect, particularly of lower eyelid surgery, lower blepharoplasty, is there's like enough support that will support the eyelid rather than it coming down. Um, in terms of anatomy, often like younger people have something called negative vector, and that can be very obvious looking at a side profile. And on a side profile, in most people, the upper part of your cheek sits a little bit in front of your eyelid. But in younger people who have kind of puffiness, bags, maybe from your 20s, 30s or so, that upper part of the cheek just sits further back, and that's called negative vector. And so that's something of key importance that needs to be kind of did at the same time to avoid scleral show, to avoid the lower eye looking too low afterwards.
Well, Dr. De Silva, that was a fantastic explanation there, and
Yes.
very, very interesting to consider, the age groups and how much puffiness is under the eyes due
Yes.
to, well, tiredness and of course bags under the eyes. A lot of factors to consider when I suppose talking to patients in your consultations.
Yes.
And mm, yes,
Okay.
I was going to maybe ask how long would a consultation with regards to this
Mm.
specific area last typically?
So, I mean, a consultation for kind of eyelid surgery, blepharoplasty, generally would take about 45 minutes. And I mean, that's
Okay.
quite a thorough process that I do for my patients because I really want to assess each individual like carefully, discuss what that individual person is really looking to achieve in terms of expectations, and to talk them through the journey, the healing, the recovery, what to
Uh-huh.
expect. It generally does take about that long. I mean, more and more of my patients, they've done a lot of research beforehand, and I've really tried to provide patients with as much information. And so I've done a whole series of YouTube videos on healing and recovery and anatomy and, the whole journey, which means that patients who've looked at that beforehand, well, actually, a lot of their kind of concerns, questions, worries are often addressed in advance. But even now, even in 2025, I still have patients sometimes come and see me who have been so anxious about their eyelids. Something has bothered them for maybe 10 years or more, but they've been concerned about looking too different, side effects from procedures, and often, those patients, they need like a thorough consultation in order to be able to make the best decision for
Oh,
them.
of course, absolutely. Well, Dr. Julian De Silva, a very revered consultant ophthalmologist who has expertise in a wide variety of eyelid conditions, eye related conditions. If anybody listening or watching would like to consult with Dr. Julian De Silva, they can head on over to his Top Doctors profile and book a consultation via our platform online. And Dr. Julian De Silva, thank you so much for your time and your thorough explanations.
Connor, thank you very much. It's been a lot of fun. I hope it's going to add helpful hints and suggestions to some of the people watching. And if you have any other questions or thoughts, just let me know.
Fantastic. Thank you so much, Dr. De Silva.